Hello, and thank you for joining me today. My name is Fern Fields, and my capstone project is on quantitative blood loss in the postpartum patient. According to the American College of Obstetricians and Gynecologists, also called ACOG, postpartum hemorrhage is a cause of approximately 11% of maternal deaths in the United States. It is also the leading cause of death on the day of birth. In the past, and currently in some organizations, the delivering provider gives a visual estimation of blood loss, also known as EBL, and this is what's recorded as their official blood loss at delivery. Research suggests that obstetric hemorrhages may be preventable with prompt management. Although this implementation was mandated Air Force-wide in 2019, providers and multidisciplinary team members at a base in Japan have a negative perception of the practice due to additional workload, time, and lack of data supporting the QBL impacts. To improve this perception and cooperation at this base, education and process improvements will need to be a top priority. The overview of today's project is: how is quantitative blood loss more accurate than estimated blood loss? How to present QBL to obstetric providers and multidisciplinary teams to receive support during deliveries. Will QBL improve maternal postpartum hemorrhage rates? The focus of this QBL project will be on a multi-service unit at an Air Force Base hospital in Tokyo, Japan. They have 4 mother-baby rooms on a 15 inpatient bed unit. They staff 9 OB-RNs and 3 OB-GYN providers. They have an average of 15 to 20 deliveries per month. Adequate and timely management of patients with increased postpartum blood loss is crucial for their outcome, but relies heavily on real-time measurements. Unfortunately, data shows early identification of postpartum hemorrhage and applying prompt treatment has been inaccurate. Understanding the need for and identifying proper procedures to accurately conduct QBL is being revised and improved by a postpartum hemorrhage working group in the Air Force. According to ACOG, studies have shown that estimated blood loss accomplished by visual inspection is more likely to be underestimated than QBL when volumes are higher and overestimated when volumes are lower. Initial implementation at this base in Japan revealed that the amount defined as postpartum hemorrhage was occurring at almost every delivery. This in itself also caused the OB providers concern, and they questioned if the measurements were proper. Fortunately, for the Air Force patient population, the implementation stands. This practice will allow providers and nurses to be proactive with bleeding treatments and allow the multidisciplinary team to be on alert. OB nurses must collaborate and get involved in the postpartum hemorrhage working group to ensure best practices are being followed and negative experiences are shared. Providers must understand the importance of early identification and proactive treatment. Education about QBL must be provided to all multidisciplinary teams involved in care of the OB patients. Positive outcomes save lives, reduce length of stay, reduce infection rates, improve patient satisfaction, and preserve blood supply in hospitals. Some of the suggested interventions to implement QBL at this Air Force Base hospital in Tokyo, Japan are: create local QBL team and develop policies and attain resources. The QBL team should attend teleconferences with Air Force leaders that are implementing new protocols. They can share needs and barriers amongst other Air Force bases, and everyone can gather lessons learned and best practices. They should educate their staff by emailing and posting PowerPoint slides and holding multiple briefings for question and answers. They can build a binder for their unit library, include references, tools, and information on who the unit point of contact is for further information. They should also create a standardized auto-calculating Excel sheet to utilize with the pre-filled in dry weights for soft supplies. I would like to review some of the data that I found during my literature review. A multidisciplinary expert review panel in New Zealand reviewed cases of severe maternal morbidity caused by obstetric hemorrhage and assessed the potential preventability of those cases. 120 cases were identified, and 36% of those were deemed potentially preventable due to delay or failure in diagnosis and delay or failure in treatment. 23% of those cases resulted in hysterectomies, and 1/3 were deemed preventable. In a separate study, it had been known in France that visual estimates of blood loss during deliveries were imprecise, thus delaying diagnosis of postpartum hemorrhages. There was a study conducted in all French midwifery schools of students in their 5th and final year. It was the first study that considered the capacity for visual estimates from future professionals. The results revealed only 35% were accurate, and thus the visual accuracy and reproducibility of visual estimates were low. In another article, it highlighted some of the challenges of a small hospital. I reviewed this because the hospital in Japan is also a small hospital and requires a lot of transfers and/or external help. 13 hospitals in South Africa were reviewed, and 93 cases were near misses, and 7 resulted in death. Results from the study suggested that decision to incision intervals for cesarean sections were excessively long, and structural deficiencies and transfer delays were frequent. This article highlights the importance of small facilities with limited capabilities and resources. Can QBL reduce errors or reactions from unnecessary activation of protocols? According to an observational trial, QBL would result in fewer activations of postpartum hemorrhage protocols after cesarean deliveries. 42 cases were observed, and both EBL and calculated QBL were compared in 4 categories. It was confirmed that use of QBL during cesarean deliveries reduced the number of identified postpartum hemorrhages by more than 50%, and prevention of unnecessary activation of protocols as well. Current treatment that's being used for postpartum hemorrhaging. Tranexamic acid is a synthetic analog of the amino acid lysine and was invented in 1962. The drug prevents bleeding by inhibiting breakdown of fibrin blood clots. Used in severe surgical bleeding, the WHO recommends its use for women with postpartum hemorrhage. The use of tranexamic acid, or TXA, has gained popularity and currently used in the Air Force labor and delivery units as a first-line drug with postpartum hemorrhage. A study in Switzerland aimed to validate the feasibility and precision of measured blood loss during both vaginal and cesarean deliveries by comparing hemoglobin-based formulas as an objective. The most reasonable hemoglobin value should be measured at the 48-hour postpartum time, unless a blood transfusion was done. This study revealed that the measured blood loss highly correlated to the calculated blood loss in vaginal deliveries. This research should be used for future alternatives to validating blood loss with the hemoglobin comparison. All of the ANA scope and standards can be applied to this project. However, to highlight a few of importance, we start with Standard 8, Education. The graduate level nurses should use current healthcare research and other evidence to expand knowledge, skills, abilities, and judgment to enrich their role. Standard 9, Evidence-based practice and research. The graduate level nurse should strive to contribute to the field by conducting research to discover, examine, and evaluate current practice or theories to improve outcomes. Graduate level nurses should promote a climate of research. Graduate level nurses should disseminate research findings through activities such as presentation, publications, and journals. Standard 10, Quality of practice. Graduate level nurses should provide leadership in design and implementation of quality improvement. graduate level nurses should design innovations to affect change in practice and evaluate the environment in relation to existing evidence. All of these standards are being upheld in this project by Air Force nurses and leaders. Let's discuss the planning phase of the QBL project at this Air Force base in Tokyo, Japan. The communication plan. The QBL team should attend conferences or teleconferences led by Air Force level professionals. They should communicate on a continuous basis with local staff to ensure they are aware of the coming change, the expected timeline of implementation, and evaluate the feedback they receive during question and answer briefings. The planning timeline. From October 2019 through December 2019, Air Force leaders and local QBL teams will meet to discuss implementation, research, tools, resources, and distribute Air Force level guidelines. They will have bi-monthly teleconferences with other Air Force bases to discuss challenges, seek suggestions, and provide feedback to each other. Budgetary needs. In order to conduct real-time measuring, a scale will be needed for weighing saturated pads, chucks, and other soft supplies used during deliveries. Ensure only calibrated under buttocks drapes are used during vaginal deliveries. Funding sources. To preserve funding sources, units can utilize their portable infant scale for weighing their soft supplies. The implementation and evaluation will be as follows. Timeline for the implementation. In January of 2020, rollout will begin. By March 2020, implementation is active. By April of 2020, teams will be assessing, evaluating, providing feedback to local and Air Force level teams, and they will all adjust accordingly. Evaluations. Local QBL teams will conduct chart reviews weekly during the implementation rollout and activation. Local QBL teams will conduct spot inspections of real-time calculating and use of tools. Perinatal site visits will be conducted every 2 years by Air Force obstetric and neonatal experts. Every labor patient deserves safe, evidence-based care. Data shows that QBL is recommended to provide early identification of postpartum hemorrhage and decreases unnecessary activation of protocols. In accordance with ANA standards, QBL teams should educate staff and participate in ongoing research in order to provide quality care. Collaborating with multidisciplinary teams is vital to the success of every delivery on the unit. The Lord is my strength and my shield. In him my heart trusts, and I am helped. My heart exults, and with my song I give thanks to him. Thank you for reviewing my QBL project.